Hello, everyone. It's August the 29th on Monday. Again, we continue to have deaths to report. I've said many times this thing is not over, but we can live with it. There's an absolute surefire way that we've got to be able to just live with it. That, like it or not like it, is vaccinations and your boosters but nevertheless, we've got 13 additional deaths. I ask for your prayers for all these folks, and especially if you know them, please call. Please call. The 7,262nd death is the 71-year-old female from Wayne County. The 7,263rd death, 83-year-old female from Kanawha County. The 7,264th death, an 89-year-old male from Marshall County. The 7,265th death is a 75-year-old male from Lincoln County. The 7,266th death, a 77-year-old female from Summers County. The 7,267th death, a 92-year-old female from Wood County. The 7,268th death, an 82-year-old male from Kanawha County. The 7,269th death, an 89-year-old male from McDowell County. This is what I really hate to see. The 7,270th death, a 38-year-old male from Cabell County. The 7,271st death, a 58-year-old female from Mingo County. The 7,272nd death, an 86-year-old male from Kanawha County. The 7,273rd death, an 81-year-old female from Upshur County. The 7,274th death is a 73-year-old female from Mercer County. 13 more great West Virginians. Please keep them in your prayers. Active cases, 3,120. New positive cases in the last 24 hours, 2,162. The daily positivity rate at 14.19. Cumulative rate at 8.47. Our recovered cases are 570,303. We have 299 people that are hospitalized in West Virginia with COVID, 47 in the ICU units, and 13 that are on ventilators. We do have a sprinkle of green counties and mostly yellow, but we've now got 5 gold counties. You can see it's just as plain as it can possibly be that this thing is not over. You got to remember that we've had all kinds of fairs and festivals. Just completed the state fair in West Virginia. We're back in school and in many places. And with all that being said, really and truly, the odds of this thing cranking up and getting worse than it is today is pretty profound. There's a bigger need for you to get those booster shots and vaccinations, but nevertheless, we're going to be respectful of all, but I'm going to continue to encourage. Especially if you're over the age of 50, please get that booster shot. Numbers continue to slow but sure. They can continue to get a little better, and all we can do is come in front of you and encourage you and tell you over and over, what we think is the best. But we try to tell you truthfully, and we try to be respectful to all. We're absolutely always going to report the truth and to the very best of all of our abilities. We make mistakes just like anyone. But the one thing you can count on me for is absolutely without any question, I'm going to tell you the truth. From the standpoint of our vaccine calculator and all the information about COVID, it's up on our website. If you'll go to our website and register on our vaccine calculator, we'll be able to give you a reminder of when your shots are due and your boosters are due. Long-term care facilities, we have 109 outbreaks at this time, none in our church community. We have 153 inmates and 52 staff cases in corrections. The Homeowners Assistance Program is still available to you. It's significant dollars. But if you're experiencing a financial hardship that's related to COVID, please just call us and see if we can walk you through this and get you qualified. You know, the dollars are really significant, really, really significant. But you know, I've said this before, but it's so profound to tell you. I'm gonna read this to you. The program can provide assistance for past due mortgage payments up to $15,000, past due utility payments up to $2,500, past due insurance, property tax payments, and other housing costs up to $5,000. It's really significant if you'll just call us. And this is for homeowners. I encourage you all the time about giving blood, and please check with your physician. And if if that's all, you know, ready to go and everything, just please consider it. Red Cross, we all need the blood, so please, please, please consider. Now, a couple of economic development announcements. Tomorrow, I'll be joining other officials with the Green Power Motor Company that's going to cut the ribbon, you know, for their manufacturing facility in South Charleston. Big deal, big deal. You know, current manufacturing footprint looks like 80,000. It looks like that could very well grow. They produce all electric school buses that will be able to run 140 miles on a charge, you know, before the, you know, and the recharge in as little, and they'll be able to recharge in as little as 3.5 hours. They plan to create 200 new jobs right now, with hundreds more to come, and lots and lots and lots of really good stuff there. So we congratulate Green Power and all the folks that worked really hard to make this become a reality in West Virginia. It's good stuff, really good stuff. Then on Wednesday, I'll be at the Chamber and at the Chamber of Commerce Summit at the Greenbrier, and we'll be bringing to you another major announcement on that day. You know, another major economic development project and everything that we'll announce on that day, which will be day after tomorrow, and we're going to hold back on what that's going to be, but it's exciting. More and more great stuff coming to West Virginia. And the last thing I have is a really dear friend of mine. You know, Miller Hall has resigned from the school board. He's our past president. He did an incredible job. That's all there is to it. Miller is moving with his family. They're moving closer to their grandkids and everything in Pennsylvania. We wish him the very, very best. Miller Hall will always be a great West Virginian and everything, but at his age now, he wants to be with it closer to his grandkids, and that. I don't know how it gets any better than that. And so from Joy and Miller and all that great family and everything, I want to tell them, and I mean this, I really mean it with all in me. You know, I love Miller Hall and that family. They absolutely have been just the greatest with me that you could ever imagine. You know, my son Jay in the 10th grade was, going out for basketball tryouts and just destroyed his ankle. I mean, bones sticking out of his leg and lots of bad stuff and everything. And Miller, I mean, Jay was in a wheelchair for a long time. And Miller was the principal of the school. And day after day after day, we'd drive Jay up to the school, and Miller would meet him there and help him get into school. I mean, a person that truly loves children and loves children, like I would say, beyond good sense. You know, devoted his life to education. What a job he's done, and we'll miss him. We'll miss him more than you'll ever know. You know, I tease him all the time. You know, but he was a basketball official. He was so much, and it was all surrounded, everything around kids. And good man, a great family. So Miller, we want to wish you the very best in every way, and I know you love those grandkids really beyond belief, but at the same time, I know you love West Virginia. I know you love all of our kids. We thank you for all that. We welcome you to come back and be back with us always, all the time. So anyway, thank you so much, and that's all I've got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And I think it's notable to take just a second and reflect on the findings and facts that the governor has committed to continuing to have these briefs for COVID-19 as his commitment and all of our commitments to stay true to our mission, which has been saving lives, protecting well-being, protecting hospital capacity, and trying to keep the state of West Virginia together. And in that spirit, I want to make it just very few comments today. But as the governor said, there is evidence that while in some parts of the country, COVID-19 is plateauing, and we anticipate that happening now and in the near future in West Virginia, the BA.5 variant, Omicron BA.5 variant, is still responsible for about 90% of the cases. When we look at Walgreens, the drugstore that does PCR tests, the genetic tests for COVID around the country, their rate around the country of positive tests is still 34.6%. And West Virginia's rate and people that go to Walgreens stores to get their PCR test is still at 42%. So a great majority of, well, that's not true. A large number of the people that go get tested, greater than our percent positivity rate for Walgreens stores around the country and in West Virginia, are still testing positive, which does reflect the fact that we are not done with COVID yet. The new Omicron booster shots will be coming, we anticipate, right after Labor Day. And these vaccines are going to be available to a group of people that we will get the recommendations from the CDC and the FDA coming up. They're having their meeting soon. But we anticipate that in West Virginia, we will make sure that we are prioritizing these vaccines for people who are in the highest risk categories, as the governor said. People over 50 years old, which account for about 95% of our positive tests, and about 95% of our deaths. People over 65 years old that are responsible for about 75% of our deaths, even though the governor did read a younger person this morning earlier. And also to realize that in the US, COVID in 2020 and 2021 were the third leading causes of death. And in 2021, in 45 to 55-year-old Americans was the number one cause of death. We have received over 600 million vaccines in the US. And as the governor said, staying up to date with our vaccinations, and particularly for those who will be eligible, please consider also becoming vaccinated with the Omicron booster shot, which will have more activity against the current Omicron variant that is spreading. And if we do that well and continue to stay together as we have, we will continue to thrive as a state. And for us and the leadership team, we are very thankful for the governor's leadership and his commitment to continue to share with our citizens the opportunities to avoid death or hospitalization or even severe disease, and also be able to reduce the risk of long COVID by staying up to date with vaccinations. And in the near future, if you're eligible, please considering the Omicron booster shot as another part of that protection. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Today ends the second pre-ordering day for the COVID-19 Omicron booster, which is the updated booster, as Dr. Marsh, the governor, pointed out. The CDC meets on the 1st and 2nd of September. Following that, then CDC and FDA approval, we should see sometime after Labor Day, we believe, the rollout of those particular vaccines. We have been working diligently with the appropriate organizations on ordering process. Then tomorrow, that opens up to a broader group for ordering. Again, as pointed out by Dr. Marsh and the governor, based on the challenges we've had with and the loss of great West Virginians, primarily based on those demographics, we are going to be focusing on long-term care, assisted living, West Virginians over the age of 65, and then we'll also be engaged in working to get those updated boosters to healthcare workers, first responders, and those on the front lines. We have approximately just short of a 50,000 dose authorization in this current initial phase, and between the various groups, we'll be ordering up to about that point. As the governor also pointed out on those hospital numbers, today 328 in the hospital. We dipped below 300, but popped back up again today. And we continue to watch that, as the governor pointed out, with all the things that are going on in our state, and now Labor Day events coming up. We will be watching closely, because we will certainly see a surge going forward. But again, we ask all West Virginians to pay attention to our vaccine calculator. Any questions and concerns about that Omicron booster, that updated booster, please reach out to our hotline, and we will do everything we can. This most important phase is about educating West Virginians to this next updated booster and getting that out as quickly as possible. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. Just a reminder, we're talking about the new boosters that are anticipated to be coming out soon. We would encourage everyone who's still eligible for their boosters right now for the 4th dose to go ahead and take them, because as the team mentioned on here, the Omicron boosters that are anticipated being approved are going to be prioritized for long-term care and older than 65. So if you're older than 50 years old and you can get your 4th dose, we still encourage you to go ahead and get that. Thanks.
Thank you, Doctor. And finally, to Secretary Bill Crouch with the DHHR.
Thanks, Jordan. Good morning. DHHR has a new Children's Mental Health Collaborative supported by 3 of our bureaus: the Bureau of Behavioral Health, the Bureau for Social Services, and the Bureau for Medical Services. This is called Kids Thrive, and this has truly been a group effort by these 3 DHHR bureaus to get this project up and running. The West Virginia Kids Thrive Collaborative will host a virtual session every Tuesday from 12 noon through mid-October. There's a slide up on that. We encourage families to attend these virtual sessions to learn how they can receive services for children with serious emotional disorders. There is no cost to attend. Please visit kidsthrive.wv.gov for more information and to register. And also call 844-HELP-4-WV. That's 844-HELP-4-WV. I want to thank our 3 commissioners and their staff, the folks who work together to put this cooperative together. It's a great effort to help our children in West Virginia who need help. So thank you all for that. Thank you, Jordan.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you, Governor. I'm wondering if you could take a moment, being the governor of the state and, of course, a very well-known dog lover, about the incident which happened in Charleston over the weekend and the loss of a canine officer. And generally speaking, the rash of shootings happening in the state's capital city over the past couple of weeks. The mayor has come out and says that she's sick of it and something has to be done. I know you've got bigger fish to fry when you deal with the entire state, but since you work in the Kanawha Valley and in Charleston, I was wondering if you can give your take on what happened with the K-9 officer and, generally speaking, your view of things from the Capitol about how things are going downtown just a few blocks away. Thank you, sir.
Well, you know, Kenny, I surely don't know the inner workings of city government down in the middle of Charleston, you know, or all the workings, you know, but you know, this day and time, we've got to do more than just really talk about stuff. And, you know, this is a tragedy beyond belief, and there's no question, you know, that this great man, you know, all the wonderful stuff that you know has been done, you know, especially from the standpoint of looking after. I know, you know, Kenny, you're a big time dog lover, so am I, you know, but it's just tragic. I mean, it's tragic beyond belief, and this officer, you know, it's just. I don't know what to say. I mean, I really don't know what to say other than the family and all the loved ones and everything, and all these comrades and everything. It's just tragic beyond all comparison, you know. And from the standpoint, you know, that you know, in regard to the dog and everything, that's just it's just not good. Now, so with all that being said, you know, I sympathize with the gentleman. I sympathize with, you know, the man that works so closely to these dogs and everything. There's far too many shootings going on all across this land. But when you think about shootings in Charleston, West Virginia, in our homeland, it really is disturbing. You know, I'm sure that, you know, Mayor Goodwin is doing, you know, everything that she knows that she can do, you know, and I'm sure that there's a lot of folks doing the same thing, but that isn't good enough, is it? We got to do more. And these silly, just thoughts that people come up with, defund the police and everything is I can't fathom. I just cannot fathom somebody coming up with that thought and thinking that's a rational thought, you know, but that's where we were, you know, a year ago. Now, people have been trying to walk that back over and over and over, have they not? You know, but you know, the net of the whole thing is too many shootings. Got to do something about it other than talk about it. We absolutely need to support our men and women that are brave people that run to the fire and protect us in our police forces every day. This is a tragedy beyond belief. You know, when you know, one of our, you know, canine experts, really the dog, you know, is killed in a situation and by somebody that was a felon. I mean, it's just, you know, I don't know. At the end of the day, I really believe this and believe it with all in me. We want to do more to help from a correction standpoint. We want to try to rehabilitate folks and everything in every way, you know, to where they can come back into productive work life and everything for all of us. I am 1,000% behind all that, but at the same time, I truly believe just this. Just turning people back out on the streets, and I don't know that this was the case whatsoever, but turning people right back on the streets like New York City is doing every day, over and over and over, is the most ridiculous thing I have ever heard of in my life. And in West Virginia, if we get to the point in time where we're overcrowded and whatever it may be with our correctional facilities, instead of turning people back, what we need to be doing is building more jails. That's just all there is to it, you know. And this beautiful comrade of all of us, Axel, is going to be missed, and I'm sure he did a wonderful, wonderful job, and he was loved, and it's a shame. So I hate to go on, but I'm pretty passionate about all that, Kenny, and you know that.
All right, thanks, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask if we could talk a little bit about what we can expect from our hospital numbers over the next few weeks. I know about a month ago we had said we were on track to reach 500 patients by Labor Day, but it looks like we're not going to hit that next weekend. As General Hoyer said, our numbers have fluctuated a little bit. We're hovering right around that 300 range. With the expected plateau that Dr. Marsh talked about, what do you think we'll see in the next few weeks? Thank you.
Dr. Marsh, I think you've got to answer this, and then maybe I can follow up a little bit, but go ahead.
Sure. Thank you, Governor, and thank you, Charles. So we anticipate, Charles, that we will see a leveling as we have recently of hospitalizations for the next few days to maybe a week or so. And then we should start seeing some reducing of those numbers. I think that it's important, though, to recognize, and we've said this throughout the pandemic, that we are, not creating the sort of the future here. We are trying to navigate with the virus, and the more people are staying up to date with their vaccinations, the more people are testing to define when they do have COVID-19, and particularly for people over 50 and over 65, if you do have it, making sure you contact your primary care person or your health team to try to get Paxlovid, which we talked about last week in the brief, is remarkably effective, even in people who have been up to date with their vaccinations, of reducing the risk of hospitalization and death. So we've talked about this many times, that part of the hospital numbers are going to be related to the action of COVID-19. And as we know now, the Omicron BA.5 variant is dominant. But the other really important variable here in controlling hospital numbers is the actions of each one of us. Because if we stay up to date with our vaccines, and if we're eligible, get the Omicron booster shot that will come out we believe after Labor Day, and make sure that you are staying attentive if you develop any symptoms, or if you're exposed to somebody with COVID, go ahead and test yourself. And if you test positive, you're in that risk group, then get treated with the Paxlovid, which is really, really effective. And if we do all that together, then we will see hospitalization numbers go down and stay down, we believe, for the future. Thank you. Back to you, Governor.
No, I think you covered it. I really don't have anything to add to that.
All right. Well, thanks, Charles. Governor, I'll turn it back to you.
Okay. Again, and just listening to our experts speak today, and and I appreciate them more than they'll ever know. They're the greatest of the greatest. But I just made these notes just a little while ago. I said, can you imagine really how on top of things our people are? Now they're reporting to us that there is a plateauing that is happening in some places in our country. And they are projecting that as time goes forward, that moves right to West Virginia, and it's done it over and over and over. Now, we don't have any guarantees, do we? But they are projecting, and they are the best of the best of the best, that really and truly we've got maybe some better days ahead of us. Now, they're also saying, just like myself, that this thing's not over. It's probably not going to be over for a long time. There is really a methodology and way we can live with it without any question. But they're giving us some really good news here. And that's great work. Again, it is amazing how on their game they really are. We absolutely, without any question, look forward and would celebrate any level of easing off and everything. Don't want to drop our guard, but it just looks like that just maybe things are going to get a little better in West Virginia. They've also told us about the new Omicron booster and everything that's coming out right after Labor Day, and how the fact is that it's going to be targeted toward our nursing homes or those over 65, and so, Dr. Amjad reported, that if you're due for your booster shot, don't sit around and wait on this, because they're going to be basically set up in a way because we're not going to have enough just to go around to everybody right off the get-go and everything. And so if you're due for your booster shot, especially if you're between 50 and 65 years of age, get it. Get that booster shot. I think this is correct, and Dr. Marsh, you know, if you would confirm this, but I think you said that in the U.S. today we have given in excess of 600 million vaccine shots. Is that correct?
That's correct.
Now,
Yes.
just stay with me, and I want all those that are with us and watching and everything, just stay with me and ask yourself just this. In the U.S., we've got a little over 300 million people, and we've given almost double that in vaccine shots and booster shots and all that total get together. 600 million plus vaccine shots and or boosters that we've given out in this country alone. Now ask yourself one question, and just please ask yourself this question. How many incidents do you know that really bad outcomes came from a vaccine shot or a booster shot? How many do you know? How many do you see that are reported on the nightly news? How many do you see? And if there were any level of significant amount, it would have been the number one thing on the nightly news over and over and over. So what's that telling every one of us? It's telling us that they are incredibly safe, incredibly effective. Absolutely, we're blessed, you know, and I give credit where credit's due. We were blessed by President Trump and the expediency of how hard they worked and how fast they worked to deliver us a vaccine. But not only that, way more importantly than that, we're blessed by God above to be able to have given us that vaccine. But 600 million have been given, plus 600 million plus shots have been given. How many do you know? How many do you hear of? How many do you see on the nightly news? How many situations do you hear of where people have had a really bad outcome? It's not many. It's not many at all. To be perfectly honest, they're super safe. You really, really need to consider that. And the last thing I've got, you know, is I reported to you that there was 299 people that were hospitalized. General Hoyer updated that to 328. You know, we look forward to better numbers and this plateauing and everything. We're very, very prayerful that that's going to happen. But nevertheless, I pay real attention to you guys, you know, and ladies, as far as our experts. Thank you for all you do, and I hope to goodness that everybody will listen to you just as much as I do, because you're really, really good. You're really great at your game. Thank you so much.